when the baby was about a month old, I started realizing I was crying all the time, and that was not normal. I used to have depression when I was 14. So when I realized I had it, I was talking to my mother-in-law, asking her if she thought I did too. And she told me it's the best way to find out would be to talk to my doctor. The next day, I ended up calling my doctor and saying, this is what's going on, can we talk? And he ended up giving me some medicine for it to see if that would help, and recommended to therapy, which I ended up going for. Some of them are easy enough to access, and then others, you have to go through these tests, you have to go through these therapy sessions before, or you have to prove that there's actually something wrong. My mom was one of the people that actually understood because she had me really young too. So she remembers what it's like, and she also faced postpartum depression for a while. So when I realized and I talked to her too, she kind of helped me explain to my family what was wrong. I was really embarrassed about the fact that I ended up getting postpartum depression. I didn't want to admit it, and but at the same time I knew I had to because I knew it could get a lot worse.
If we as physicians or any provider don't know to screen women for postpartum depression, we're going to miss probably 90%. We probably do a reasonable job with screening women. It's that there's no organized program of universal screening in the same way that we have for perhaps mammograms or pap smears. So I think that that's maybe perhaps the bigger issue, that we need to make sure that every single woman gets formal screening for postpartum, because the ones who aren't presenting are probably the ones that need the help the most.
In many of our communities, we don't have access to the practitioners that make the diagnosis. So many of us don't have medical doctors or nurse practitioners or psychologists or psychiatrists that work in community. So we need to be linking with those healthcare providers outside of our community to make the diagnosis. And that can be a challenge if that person doesn't even have a healthcare provider. And that's a reality for lots of Indigenous people, is they don't have healthcare providers, and so they don't get one. They will choose to go to the ER, and sometimes there's not even a healthcare provider that can make that kind of a diagnosis. So I think diagnosis is perhaps the biggest challenge and barrier.
If a woman is experiencing a moderate to severe perinatal depression, either in pregnancy or in the postpartum period, we can consider referral to a psychologist or to a psychiatrist. As family doctors, we can also discuss with her the benefits and the disadvantages of using medication. We can also suggest in-depth counseling, such as interpersonal psychotherapy or cognitive behavioral therapy, as options. It's extremely important as clinicians that we regularly check in with parents. Many studies have shown that postpartum depression isn't necessarily something that happens immediately after birth, can actually happen around the 4 to 6 month mark.
Sometimes as healthcare providers, we don't ask the questions about emotional well-being. Sometimes we tend to focus on more the physical, how the baby's feeding, how the baby's growing, how the mother's body's returning to the pre-pregnant state, and not asking how they're feeling emotionally. So getting the conversation started, getting an inventory of what services we have in Northwestern Ontario is really important, because what hopefully it will do is identify what the gaps are.
I think a universal screening can be very helpful in helping to create an entry port. When you think about an entry port, there's referrals that can come from many different sources, and I think the more that we speak a common language, the more that people are understood, and the more that we can identify what are the services that need to be available at this time. So anything that's universal and informed, I think, is helpful.
Right now, there isn't somewhere that I can just pick up the phone and refer them to for comprehensive services. Services are fragmented amongst different communities. Some have a program, some don't. Some have short-term funding for one, the funding runs out, and there's nowhere to go. It's a problem which is often in the dark. There's a lot of shame and a lot of denial around it, and women and dads may not come forward. This is where I think that we need a comprehensive menu of services depending on the severity of the illness and the family's needs, which is consistent across the province, readily available, and easily accessible.